right, guys.
Good
You're
evening,
Karen,
I'd
you're
like
staying,
to call
right?
Special
Yes.
Services Committee to order at 6:24. Item 1 on our agenda is approval of September 15th, 2022 Special Services minutes.
Motion?
Thank you.
Is there a second? Second. Discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Item 2 is enrollment update, which is in our backup. Ms. Hebert?
Yep, so K to 12, 3,829, and then when you add preschool, 3,898.
Any questions on enrollment?
The question was brought up last month about why there was a difference between 8th grade to freshman year. So Kim and I did some looking into it. We do get about 45 or so students from Wakefield, Sanbornville. So that's about half the kids right there. Then you might have another, like say 20 students who either came from another school and didn't have enough credits, or homeschooled, came from a private school, or were our students who failed to go to summer school or remediate to get their credits. So those numbers get added back in. And then of course you always have students who move into the district, so you could have say like another 10 kids that were added. So it wasn't that there was a housing boom that dramatically increased those enrollments. Those are pretty standard year to year what we get from Wakefield and from students who don't have enough credit.
Thank you for taking the time to look into that. Any questions, comments? Ms. Stokes?
Is that, I've been on the board 6 years and I've never even noticed that number, so good. I was amazed that somebody else picked that up. Is that normal? Is that a normal number? So is it, you know what I mean? Or was that like more COVID numbers?
No, that's fairly typical.
That's a fairly
Yeah,
typical
I mean,
number.
Depending again how many people live in Wakefield and Sanbornville, and again, some of our numbers fluctuate,
Yeah.
but I mean, typically that's pretty common.
Okay.
To get over 40 kids from them, plus have some students that maybe come back from a home school or come from a private school. And then again, students who didn't earn enough credits to be considered a sophomore.
Okay.
So some of those kids were Spalding High School freshmen last year as well.
That just stayed as a freshman.
Yes.
All right, thank you.
All right, item 3, bus update, which is also in your backup.
So there were concerns about the buses and the bus times and students getting to school on time. So Kim and I have worked with the bus company, and they've updated the route times earlier so that everything is happening earlier, and that seems to have helped to get students to school in a more timely fashion.
Excellent, that's great. Any questions or comments? All right, item 4 is youth risk behavior survey. I'd like to invite Ms. Michelle Halligan-Foley and guests. Sure, yeah.
Perfect.
Great.
So good evening, everyone. It's nice to see everyone again. So every 2 years, we do the Youth Risk Behavior Survey. And Ashley's going to talk a little bit about the details of it, but it really looks at behaviors and changes over time for our students. So tonight, we're going to focus on the middle school Youth Risk Behavior Survey. And then next month, we're going to focus on the high school results. We just got those results today, so I need to sit and review them and analyze them. I wanted to start off by saying we have a really strong team, and I thank school board for that. We have Michael Seeley here. He is our middle school student assistant program coordinator. We're able to have him here because we have a grant, an SAP grant, that we're able to write and receive because of these surveys. So we use these surveys and the data from the surveys to be able to get this grant. I've been writing the grant since 2016, and we've had $100,000 a year to be able to support our students. So very grateful for that. We also have Nicole Dale Hodgson. She is our master licensed and alcohol drug counselor. She is now a district employee and working very closely with all of our students, doing prevention as well as intervention with our at-risk students. Lisa Gauthier, she is our social worker, but also does a lot of activities and has a lot of experience with students who may use drugs or have families who are involved with any type of drugs. We have our middle and high school counselors. I work very closely with them and keep them up to date on data, as well as our middle and high school principals. Could not do this without our community members. They play a very important role, and they guide us and they help us and they give us resources. So tonight I'd love to introduce Ashley Wright. She is the Public Health Network Manager. We have been working very closely together on not only prevention but intervention, and she is going to share a lot of the results tonight. We have Cora Long, who is a Substance Misuse Prevention Coordinator, and she has been helping us with Red Ribbon Week, which is coming up next week. So we have multiple activities going on both at the middle and the high school. We have Nicole Rodler, who you all know. I work very closely with her through the police department. So at this time, I'm going to turn it over to Ashley.
Hi, thank you all for having me. My name is Ashley Wright. I'm the manager of the Stratford County Public Health Network. We are a program of Greater Seacoast Community Health. We're located at Goodwin Community Health in Somersworth. Cora, that Michelle mentioned, is one of our employees. She focuses on prevention. My role within the Public Health Network, amongst many other things, I focus on prevention, treatment, recovery, harm reduction related to substance use and mental health disorders. I am a certified prevention specialist. I have my master's in what I consider to be the equivalent of community public health. And really what we do as the Public Health Network is we focus on strategic planning, supporting community partners, including the schools. In our case, the schools are a community partner. We work with a number of folks across different sectors to organize people, facilitate collaboration and communication to improve the systems and environments in our communities across Stratford County. So Michelle, and thank you for your continued support as the board and for Michelle's partnership. And I look forward to working with you as well. We have partnered on a number of different things. We are really engaged in Rochester as in the Rochester community as a whole. Really recently, an influx of things happening, which was fantastic. But the YRBS is something that we've supported for years at the middle school level. At the high school level, Michelle mentioned that survey data came in today. That is run by the state, and the Public Health Network has supported the middle school survey for a number of cycles. That cycle is every other year. It's a completely confidential survey that's filled out by students during the school day. It, as Michelle mentioned, it measures attitudes and behaviors, perspectives of students that take the survey. The middle school survey is done just at the 7th and 8th grade level. This year there were 480 students that completed the survey, and this cycle was slightly different, disrupted by COVID, and was done in December of 2021 before the holiday break. It is an opt-out process. So the legislation currently in New Hampshire around the YRBS, the Youth Behavioral Survey YRBS, is an opt-out process rather than an opt-in. And as Michelle mentioned, and I've mentioned, we coordinate the funding and the implementation of this survey in partnership with the folks listed on the first slide at the schools. So, and I would be remiss to mention this survey, and our funding comes from United Way, the Greater Seacoast has supported this cycle of, and other cycles of the YRBS at the middle school level, because it does cost a good amount of money to buy all the materials, communications, planning, and of course the data analysis and report. So what I'm going to walk you through are prevalence rates. So these are numbers of students as a whole in the student body here in Rochester at the middle school level who are answering these survey questions. So we'll walk through them in categories. So here we're looking at bullying, safety. Things that are highlighted in green are positive changes, things highlighted in red are negative changes. So you can see some positive changes here with bullying on school grounds, but negative changes around cyberbullying or electronic bullying. So this is on social media platforms, texting, chat rooms, if that's still not really a thing, but that's included in the description of what electronic bullying is. And next slide, please. Here we're looking at mental health, and these numbers are concerning, and I want to look through the prevalence rates and then come back and talk about some differences that we've seen. So self-harm, depression, and suicidality is really what we're looking at here. So the percentage of students who did something purposefully to hurt themselves, percentage of students who have felt sad or hopeless for 2 weeks or more in a row, which is depression, percentage of those who have seriously considered attempting suicide. So the first two, you can see some negative changes. That third data point has relatively stayed the same, and if you scroll down slightly on the same slide, the percentage of students who have ever attempted suicide. And so again, those numbers are relatively steady, and we'll come back and talk about some differences, but 8% of students at the 7th and 8th grade level here in Rochester, and these numbers are consistent across the county, have ever attempted suicide. Looking at tobacco use, when we think about smoking rates, just tobacco, smoking cigarettes, those numbers have gone down dramatically over the last decade or two. So positive changes are great to see. There are some strange changes we've seen, even though use has gone down and stayed low, some dips in perception of harm. So percentage of students who think that they are at moderate or great risk of harming themselves by smoking cigarettes is what that's looking at. So you can see those changes, but what we're more concerned about, and next slide please, is vaping. Miraculously, but really we're glad to see these numbers go down overall. That is a really positive change and speaks to some of the prevention work that's been happening in our region. Lots of conversations at the school and community level, social norms campaign, increased perception of harm is likely but not measured on this survey. Yes?
So when you say lifetime, you said this is 7th and 8th graders.
Yep.
What is defined as their lifetime?
Ever used. Have you ever
Ever used, okay.
used? Is
So
the way
in
of
your
the
lifetime.
question. Yep.
Okay.
Yep, and past 30-day use is considered current use. It's the questions for all of the substance use questions are, have you ever used this? Or have you ever had a drink of alcohol? Have you ever smoked a cigarette?
Thank you.
And I just kind of want to mention here too, sorry.
Yeah.
But I want to mention that this has gone down. We've done a lot of education at the middle and the high school about vaping and the effects of vaping. So I think that has a lot to do with it.
And next slide, please. Alcohol use, we've seen some positive changes as well. You can see, and we really, the highlight is for 3% or more of a change. So you can see the lifetime use has gone up slightly. Past 30-day use has remained relatively the same. Perception of harm has gone up. That's a protective factor. So something we would consider a protective factor is anything that causes positive outcomes to go up. A risk factor is something that causes positive outcomes to go down. So perception of harm, parental disapproval, and peer disapproval of certain actions. In this case, we're looking at alcohol, sorry. We're looking at alcohol, so parental disapproval of alcohol use, peer disapproval of alcohol use, those numbers typically will go up as use goes down, have that inverse relationship. Here, some different things, but again, slight numbers, not really large changes in those. But it's nice to see perception of harm going up and lifetime use going down. You can see the change from 2017 to 2019 is a bit larger, which is great to see. Marijuana use, again, looking at these really seeing some positive changes in the protective factors, peer, parental disapproval, and perception of harm going up. Some dips a few years ago, but trending again in the positive direction. Prescription drug use, again, is one of those things that is low, but of course high risk related to some other substance use as well. So peer parental disapproval, while some of those changes are red, being in the 90s is a really positive thing. So high perception of harm in the 80s, parental and peer disapproval high as well. So, and just a couple protective factors that are unfortunately trending in the negative direction. We look at these things, and we also, there are other protective factors that, you know, we talk about, such as trusted adult relationships, having somebody to go to, feeling that you're supported, that your community cares about you, things like that. But on the YRBS, these are two of the protective factor questions. Percentage of those who feel their parents or other adults in their family have clear rules and expectations in general. And then the second one is if you've talked to a parent in the past 12 months about alcohol and other drugs. I do want to pause before we move on and just talk about some of the differences in the data points. So what we've looked at so far is prevalence rates, so just overall use amongst 7th and 8th graders. Concerning trends that we've seen in this iteration of the YRBS that we haven't seen necessarily across the board in years past is the difference in substance use and mental health challenges amongst females are higher in most categories than their male counterparts, two in which in some cases almost doubled. So I'm just going to read this list. These were, I'm just going to read this quickly. The numbers higher in female than their male counterparts. And the YRBS does only ask for sex, binary sex. It does not ask for any other gender identity or differentiating questions in that category. So females reported higher use in tobacco, vaping, alcohol, marijuana, prescription drugs, inhalants, and over-the-counter medications. They also reported self-harm, depression, considering suicide and attempting suicide at much higher rates. And I can pass these numbers around as well, and they're included in this report that I can share with you all. But the differences aren't slight in these either. Some of them are double or more. For example, the vaping for females was 25%, and their male counterparts were 14%. For ever attempting suicide, females reported 14%, and males reported 2%. So those differences are important to note when we're talking about interventions, strategies, and addressing the issues.
What was the breakdown of the 480?
Almost 50-50. Actually, sorry. The demographic difference was females were 49% and males were 51% of the overall survey. So there are some resources that I just wanted to share and point out. The National Suicide Prevention Lifeline has changed from a 10-digit number to 988. The New Hampshire Rapid Response Access Point is a resource in New Hampshire. You can dial 988 from a New Hampshire phone number, or more effectively directly dial this 10-digit phone number. You can also access this resource online, both resources online via text and chat. And then if you advance one more slide, please. Just some resources to note around the community. There are several groups that are meeting regularly to address mental health and substance use in our communities. Rochester Mental Health Alliance has recently formed. The opioid abatement group through the City Council has also recently formed. They received some funding for some settlements. We facilitate a couple of coalitions as the Public Health Network. We have a prevention leadership group, an addiction task force. The SAPs are really great resources to have. Social workers in the community, the police department having a lot of community focus. Hand Up, Syringe Exchange Program, SOS Recovery Community, Waypoint, to name a few. And then lastly, I just wanted to close with a couple of recommendations on things that we, suggest as community strategies to addressing mental health and substance use challenges. Really supporting groups like Rochester Mental Health Alliance, joining our coalitions and similar coalitions addressing these things, and really encouraging community involvement. We've seen a fantastic trend in youth-led work being really impactful and supported in our communities, and we would encourage you to support and involve youth and engage youth in your strategies, in your planning and addressing issues in the community. It's important to include them as well. Restorative justice practices, juvenile diversion programs. I know Nicole Rodler was listed up there as a great resource, and really focusing on not just professional development within the school, but creating those community-based partnerships and engaging community members, and again, youth, whenever we can, to really bring them to the table. And of course, I know that you've, and thank you for supporting some additional infrastructure with MLADAC at the high school this year. It's really great to see that investment, and I encourage you to continue to find those opportunities to fund the infrastructure to create positive change in social emotional learning and prevention, evidence-based prevention programming in your school. So thank you very much. I am happy to take questions now via email. I'm sorry if I went over time a little bit.
I have a few questions.
Sure.
So this is amazing, by the way, thank you very much. So we get these data and it's great, but we can't, I don't know if you know, staffing is very difficult.
Mm-hmm.
So we get this data, and I'm not sure, Michelle, if this is a question for you or you, so feel free to both chime in. How do we as a district deal with our mental health? I mean, the suicide one is alarming. You don't even want it to be 1%, but I had my pen in there and I just took my pen. 26%, but then you mentioned the suicide for female was 14%. How, if we don't have the right mental health workers, because we want to hire them, we just can't, what do we as a district do with this information, and how do we get the help to the specific students?
Yeah, so
Yeah, and I can start and I'll chime in.
I'll start. So not only are we looking at, how can we bring in supports for students who are there, who are here, who are considering and attempting suicide, right? Of course, we want to keep those students safe. We want to advocate for stronger connections with treatment providers, intervention programs, things like that. But really, what we're using this data for in a lot of our conversations and at a lot of our tables, including the Rochester Mental Health Alliance and the Opioid Abatement Committee, is what are we doing for prevention? What are we doing to establish structural, environmental, systems level changes so that these students who are feeling sad or hopeless, who are, having mental health challenges, who have, adverse childhood experiences and have had, not so great things happen to them in their lives, who have experienced trauma, how are we supporting them? How are we intervening with them and making those system-wide changes so that they don't get to this point?
Yeah.
I think a lot of that, training, of course, we have suicide prevention training that's required for schools every year. But there's more that we can do to provide, and those are the conversations that we're having, and we're using this data at those tables to say, where should we focus our efforts? Where can we really step in and having, we've done some listening sessions at the schools with students to hear, what are your concerns, where can we go? And again, those youth-led initiatives and involving youth are gonna give us so much more, specifically in the school and the community, but they're gonna give us more information, and they're gonna tell us where we can go and what they need. As long as if we give them a voice, they'll show us what's needed and how to do it.
So I was going to say pretty much the same thing, but I just wanted to give you an example. So if you remember last year, we had Lori Dennis come and talk about Connor's Line.
Mm-hmm.
And so that really focuses on student curriculum. Students are learning signs and symptoms and how to help their peers. So we're starting that, well, we have started that at the middle school. So not only are we training our teachers, but we're also educating our students to be able to find those signs and symptoms and know what to do if they hear a peer is in trouble or, needs some support.
And then my second question is, when you were talking about your recommendations and you were talking about support and involving groups like this, I mean, I feel like I can only speak on my behalf, I can't speak as a full board, but I feel the board as a whole has been very welcoming. So when you say support and involve, like what more can we do? You know what I mean? Like it's great that we're supportive and all that, but like what as a board can we do more? You know what I mean? Does that make sense? Like what is it that the board can do to make it sound as though we're supporting all this and we're involving the communities? Because you're right, a child has mental health issues or drug problems or alcohol. I mean, it's usually a family issue, or a lot of times it is. How do we as a school district how do we support more? Like,
Yeah,
how do
I
we do
think-
more?
I think having, well, one, and it might seem, a little difficult or daunting or challenging to do, but having youth representation on the school board, having a youth, a student that is here, that's representing the people that you're serving, that representation of the population being served can be really impactful in moving things forward. Being represented, and I know that you have a number of folks who are very involved in the community, including Anne, who's on our advisory council for the Public Health Network. We have, having representation within these different groups and being able, that gives you those opportunities to be able to say, hey, Rochester Mental Health Alliance, we're doing this great thing, let me see, maybe we can look at policy change, or we can look at staffing, or if we can look at funding to give you some program budgets, and just having, again, representation of the population here, but also having your representation within those groups can be really open those doors for more conversation.
So you're saying youth representation and even, like, so we have one at our full board, but even at committee levels and inviting the youth. I mean, it's something
Like, it
that's free
would've-
that doesn't cost anything, you know what I mean? Like,
Yeah.
it's, you would think that we would normally think of it, but then when you mention it, it's kind of interesting. So those were all the questions I had, thank you.
Yeah, thank you.
Any other questions, comments?
Thank you.
Thank you so much, it's very helpful to see the data.
Thank you, and I have hard copies of the report that we received, and I'm happy to sit down with anybody outside of these meetings, and once we have the chance to look at the high school data, again, we're not the ones that are looking at it, I don't have the reports, I haven't set eyes on it yet, so hopefully, continuing these conversations and looking at trends over time, and looking at middle school and high school data together, and being able to really inform our work. So I appreciate your time, I appreciate what you do for this community. Go ahead.
Do we bring the data back to the kids? I'm thinking of the 480 kids who took the survey.
So we have at the high school, we just share an overview with them at the high school. At the middle school, we haven't done that, but we have looked at the data and we have implemented different groups of support, and either large groups or smaller groups with the data of those students who may be struggling.
And I have had this conversation several times, because we, of course, this is not the only community that we do this with. There are 5 communities, and we have a district, countywide report that has come out as well. What we want to be careful with when we're sharing data is, what data are we sharing, what's the context, what's the message, and what is our intended outcome. So when we're talking with youth about substance use, and mental health challenges and suicide, we don't want to make the norm the negative. We don't want to make, what's a data point that I can use? 20% or 19% of middle school age, let me use a different one. Here we go. 15% of Rochester middle school students have ever had a drink of alcohol. That, of course, we don't want that number to be that high. As school board members, as community adults, as parents, we want them to be aware that this is a problem and how can they help. At the high school or middle school level, when we're having conversations with kids, what we want to say is 85% of your peers aren't drinking. We want that social norm, that message to be positive and encouraging and empowering of, hey, I know you might feel pressure because of things you see on social media or with conversations that you're having with certain individuals. It might seem like everyone's doing it or you might feel peer pressure, but hey, our data shows that 85%, most kids your age aren't doing this. And that's the message that we want to send. So I think it's important to show kids like, hey, we heard you. We did this survey, you did this. Thank you for talking to us. Thank you for letting us know. We're using this data to make positive changes. But also, hey, here are these really great things to create these social norms, these behaviors. And we know that, you know, having positive social norms is a protective factor and can be a really positive strategy. So I sit on the Rochester Mental Alliance and other groups across the county, and this is definitely a conversation to be had and a tool that can be used to really create additional positive change. So the long-winded answer to your question, Ann.
Well, it's
But-
just that I know when you fill out surveys, you always want
Yes.
some feedback when it's done.
Absolutely.
Find out what the answers were when it comes back, and I'm sure some of the kids that fill this out are wondering.
And that's, I mean, that's the feedback that we give the high school. We look at all the positive things and then we work with the data for the things we need to work on. We have speakers come in, we have small groups, as I said, so that's how we work through it.
And the troubling trend where girls are outpacing boys on the negatives, are we looking at that on how we can, you know,
We will be meeting to discuss that. We wanted to share this with you first, and our next steps would be to sit down, to look at it, and with Michael here to implement changes in education at that middle school level.
Yeah, and we'll look at the high school trends too and see if those trends are similar, which we anticipate that they will be.
Mr. Kinnear?
So, just kind of looking at the list of resources in and around Rochester, how do all our students at the middle and high schools know that these resources are available? And I guess that's part one. They're available if and how they would apply to them if needed. So, and then two, I guess, whether it be a self-referral or how to access these resources. So, you know, I kind of envision all these resources having a job fair, a welfare type setup where they show the students of the schools what the resources are out there and how to access them. So, just
So our, all of our school counselors are aware of all the resources. They work with individual students, all the students, and so they're aware of those. And we have our SAP and we have our LADAC at the high school. We have a whole referral process that they go through, and then we make sure that the families get the resources they need. So yes, they are all available and they are being shared with families. We also have our mental health website that we put together, and so all of the resources are on there as well.
So I guess just to follow up on that, so somebody doesn't, a student doesn't have to be identified as troubled or whatever to know these resources are out there.
No.
Just you know, part of incoming year, these are resources out there available to you type of thing.
Yeah, and we've also shared, like, for example, we had Waypoint come at the beginning of the school year and do a presentation to our teachers. So we're also sharing all of these resources with our teachers so that if they have a good connection or a relationship with the student, you know, they're aware of these as well.
And Michelle mentioned that Red Ribbon Week is next week, so we've been working with Nicole Dale. It's an awareness week for substance use prevention. We've been working with Nicole Dale Hogan at the high school to organize some activities, connect partnerships, and we're gonna have some tables, resource tables at the high school around lunchtime, and we're, you know, just to have a presence and share resources. So some of the partners that are listed up on the screen. Ourselves, as the Public Health Network, are gonna come in each day. There will be a different resource table there that students can come learn about services and connect with folks and learn what's really in their community. So hopefully, and again, having that partnership within the school, having Nicole there, having, you know, the SAPs in both of the schools opens the door for more of that partnership, more of that resource sharing, and more of that awareness of what's really available in our schools, or in our communities, rather speaking.
Just a second. I have two questions. My first question is, currently, what's the approximate wait time for a child to get into Goodwin Health Center or Seacoast Mental Health for counseling when families reach out for services?
I am not sure. I can't confidently answer that question. I do know that there is a wait time, and it's
4 weeks-ish?
maybe, do you
It's
know
more-
more?
it's more than that.
longer? Yeah.
I've seen intakes not get scheduled until like 3 months out. And honestly, by that point, the ship may have already sailed, so that is concerning, but
So what are those organizations doing to address those needs for families?
Really, those are the capacity issues, the staffing issues that we're seeing across the board, across different organizations, different sectors, different businesses, business types. You know, that's why we really, and not to minimize that, because it's a big problem, and we're talking about it at our tables, but it's hard when you can't increase caseloads, right? And so the focus on what we can do to support those who aren't necessarily in crisis, and talking about alternative peer groups, peer-to-peer supports, trusted adult relationships, what supports can we provide, not just expect the school to provide, but what partnerships can we create so that those services can be provided within school or within groups that students are already attending, and provide those out-of-treatment practice supports are really a big focus in our conversations. And I would also point to the rapid response line being a great resource for those students who are in crisis, and community members who are in crisis, to get connected with a mental health provider in the moment. And they can provide some they can move around some of those systems if people are really in a mental health crisis, and provide at least some support during that time where they're waiting to get connected to a solid treatment program.
And I'm gonna mention too, with our Mental Health Alliance Forum coming up on November 2nd, right here in the community center, we're going to be discussing these issues as a community, because it is a community initiative. So that's why all of the partners are coming together with this alliance, and I think it's going to build a very strong Rochester moving forward.
And my second question, and then I'll get to you.
My question was just yours, so you answered it.
My second question is, we talked about sharing data with the students. My question is, could we send the parents of the middle school the parental percentages so that they're aware of the parental data points?
I think it would be useful. I think we would also need to be intentional and mindful, and I don't mean to sound like a broken record, but being intentional and sharing that messaging with, and also sharing tools. There are some great tools for parents. Those conversations are hard, and I think parents, when I've connected with parents in my career, you know, resources on, well, what do I say? What's appropriate? I don't need to have those conversations yet. My parent peers aren't having those conversations with their children. And there are a lot of resources and tools out there. So I think, you know, similarly to how we want to be mindful and intentional with sharing the data and information with students, we want to be equally as important. It's equally as important to do that with parents and guardians, because what we don't want to say is, you're not doing your job.
Right. But share it with a positive
Right.
messaging with resources.
Yeah, resources and information of, hey, this number, you know, it could be higher, we want you to do these things, it's important, it's a protective factor, it's like, we have resources if you feel like you need help. You know, we are doing X, Y, and Z, here are some things you might want to consider. You know, some of that messaging and really sitting down and looking at what is the message for Rochester families? What's going to be most impactful for Rochester families? Because we all know that every community is a little bit different, and the culture and the language and what works.
Thank you. And anyone else? Thank you so much for your time this evening. We really appreciate it. We look forward to seeing you again next month.
Thank you.
Thank you.
All right, next item 5 is the 5-year plan. We do have community comments to look at. So we can pull up our, oh, perfect, thank you. We can pull up special services 5-year list. So just to review, our top 3 at the moment is number 1, athletic fields, lighting, drainage. Number 2, chorus, drama, band, space review. And number 3, growth in city and paying attention to our enrollment data. And then the parking lot, number 1, new band uniforms. Number 2, drama program, lighting and sound. Number 3, future bus runs with kindergarten. Number 4, out-of-district placements, programming to bring kids back. Number 5, athletic stipend scale. Number 6, teacher evaluation models or SMART goals. Number 7, review for food service contract. So, yeah.
I would say that item 3, future, under parking lot. Item 3, future bus runs with kindergarten, but kindergarten is full day now. I think that the bus runs are happening. And item 7, did we just do the food service contract?
Yes, we did a year ago, or a year ago.
Wasn't it?
Oh, it's new.
Karen, you were on that negotiation, right? Food
Yeah.
service? So that just happened in this past spring, right?
No, we're saying food service vendor
Oh,
contract.
my apologies.
The vendor,
Just changed a
which
year
we
ago.
just did a year ago.
Yeah.
But wouldn't hurt to do it
It's good,
every,
then never mind my comment, just taken away, but I would say we could scratch item 3. Okay,
Yep,
before we get into the,
Mrs. Stokes?
For the 1, 2, and 3, on the other, oh my God, policy, you have the number of votes. Do you know how many votes, how did you pick those for the top?
they're the top votes.
Do you know I'm assuming you don't.
We had those back then, they're in your email under the committee notes, I don't have those.
But they were on that,
They
okay,
were high votes. They
Yep.
were,
okay.
they had at least 4 votes, 5 votes, and maybe a tie
It was
for.
above 5,
Yeah,
because
okay.
out-of-district places was 5, so.
Yeah. So our assignment this evening is to look at the comments from the community survey. And when we read the comment, we need to decide, does it fall under something that's already in our top 3 or parking lot? Is it something that is more school-based and not school board driven? Or is it something new that doesn't already exist in our top 3 or in our parking lot and is something that would be school board driven? Does that make sense?
Yeah.
Just gotta go through them one at a time,
So yeah.
right? Okay.
So the first one, enter mental health resources for all ages, students, teachers at schools. So if we look,
You don't have a mental health one under here.
yeah, our mental health one, I believe, falls under instruction, correct? Don't we have mental health in instruction?
1 second. I shall look at instruction. There is not a mental health one in instruction,
Okay,
so.
well, maybe person.
Yeah, so what we'll do is I'll write down mental health. Well,
It's not under personnel either.
so I'm just gonna write down, because we have to add this to our parking lot and then do a vote, so. Just,
So, new.
Yep.
All right, and then bringing mental health support and prevention tools into the schools. American Foundation for Suicide Prevention has researched and evidence-based programs for children, teens, and adults.
I think 1 and 2 are
Mental health?
all mental health.
Yep. All right, and then the next one, changing the Spalding High School mascot to create a more accepting environment.
I would think that would fall under like a culture and climate.
Yeah, it's probably be more, yeah, we gotta broaden that, I think, probably a little bit more, that makes sense.
Do you know what I mean? Like, listen, we
It doesn't
voted.
stop with just that. or
And it's not,
only that.
right, and you're not wrong. I mean, we had that discussion a couple of years ago, and then COVID hit. But I know they had talked about, involving more of our roots. If we're gonna keep that mascot, how do we incorporate that and bring education-based? Because, you know what I mean? And I get it with COVID, but I think we need to start having that discussion again, because you can't keep having a mascot.
Yeah,
Good.
I like culture and climate.
If we're gonna have that logo in place, what are
There has to
we
be a
doing as
reason
we talked
for
about?
it.
Yep.
Yeah. I like it.
So it's,
And then the next one is the
both sides.
same thing, changing the Spalding High School mascot. So
Yep.
that falls under a new category. Discipline issues in the schools and what can be done to support staff, students, and families. We don't have anything up above about it.
So that word discipline,
See, I think that
Is
would
that
fall
a-
under personnel.
well, I think it's more of any,
Programming,
like, policy would be discipline in general, right? We have discipline policies.
We do.
These are, what do we do about the issues our schools are having?
and I
Yeah,
don't
so it's
know.
not necessarily staffing, it's,
And I don't know if this is necessarily school board or if that is more of a building.
I feel it is more of a building level issue.
So maybe we say,
we send that to district. So far I got only 2 items, so it's.
okay, and then diversity,
I think that goes under culture and
culture
climate.
and climate, I agree. Full admin staffing review and or replacement, more support for students, need for all to be on the same page as far as supporting students' needs and issues. I would say that's, again, a building.
Culture and climate. Well,
No,
it
I think
is,
it goes under personnel for staffing needs study. I think,
yeah, but reading the comment, I mean, we're talking almost like
Review,
replace all the staff.
replace.
see, I don't read that. I read more support for students, and I think that falls under, we do have a lot of open positions. Those could be para positions, those could be mental health positions. I think it would fall under what our staffing needs study are, because I don't
Which we
feel
have
like.
already as an item.
Right,
Does that
so I
make sense?
feel that's where it would fall under, because it's saying they all need to be on the same page. Well, we are, we need to hire more.
What number was staffing needs?
Was on the personnel number 1, staffing
that was
needs study,
personnel.
department by department.
So for behavioral specialists for elementary level, that's staffing.
Yep.
So,
So,
meaning,
it fell under special services because it was behavior specialist, so that's why it's under special services.
but on the staffing needs
But
study,
yeah, it's.
well,
on
that
staff.
goes,
I think it's staffing as well.
it can come from this committee through recommended personnel, an increase in that area,
For the,
but it not necessarily is a,
Don't we have a staffing position don't we have that open or no? Don't we have something like, we have that position, we just can't fill it.
Correct.
I thought, yeah.
There is an open position.
So we do need it, it is posted, we just can't fill
it
it.
is already funded, so check.
So it's better incentives, abilities.
Culture and climate. Mental health, the next one.
yeah. Okay. And that's a new one. Okay. I'd like to see more programs and staffing available to address behavioral, emotional, mental health needs of students at all levels, but particularly in the middle school. We need more support for students when they're in crisis or on a behavioral spiral. The solution cannot be for the classroom teacher to manage these situations while still supervising and teaching the remaining 20-plus students in the classroom. So mental
I'd
health.
say one, we
I think
agree.
it's staffing. again, we were looking for a behavior specialist, and that kind of would be that role that they would do.
But I think there's also a conversation that we have to have is that the right role under mental health that's needed? Like, is it a creation of something new?
Well, we also have a lot of mental health positions that we also can't fill.
Fair.
And I also think that when you're talking about like in the class level, that's also the position of like a para. Paras work one-on-one with special needs children, so you could consider them. You know what I mean? Like a parent not knowing what a special disability is could say it's a mental health
Culture and
crisis.
climate on the next one.
Yeah, so the next one is inclusion training and dealing with racism.
Culture and
new
climate.
Culture and climate.
Which I think is huge.
And next one is increased pay for teachers and staff retention, handling student behaviors, including bullying and disrespect for teachers and staff, increased parent-family engagement. So this is us and finance, because finance deals
they
with
don't
the
pay,
increase
but-
in pay.
Really
But
contract, but
we would be looking at the student behaviors and
is that more of the,
special services.
could you pull that under culture? I know it's culture and climate should be a catch-all, we kind of want to be more towards the student-based culture, but in this case,
Culture and climate.
it's still, how do we handle their poor behaviors? Because you can't do everything if they're not going to behave.
Increased family engagement opportunities, enhancement to special education, inclusive education opportunities, unified sports, social inclusion and school opportunities for children placed out of district to be integrated in social experiences with others in the district.
I think that goes under a 4 in the parking lot.
4 is out of district placements. Okay,
Because when we kids are out of district and we want to have the program to bring kids back, even if a student is out of district placement, they still have the right to play any kind of unified sport or any sport technically that they play. Correct me if I'm wrong, but I know it worked for certain kids. So if you live in Rochester but you're out of district placement, you still have the right to be able to be like in a unified sports team or extracurricular
Doesn't bring
activity.
kids back, is to bring them back into the building for instruction.
that's what item 4 represents in the parking lot, bringing out of district placed kids, creating program within our district in order to bring them back to our district.
Right, but I think that's what this does. Inclusive educational opportunities, which I think is bringing kids back into the district. Unified sports, social inclusion, and school opportunities.
I don't think it's tied to just one, it's not just, the inclusive education opportunities possibly is that one piece of it. They put a lot in here.
You could put it as just inclusion.
And then they said enhancement to special education.
Well, there's a lot in one comment, there's pieces that touch everything that we've already
Yeah.
have planned, so I don't think it's anything added.
Okay.
It's just, I don't think it's just item 4 that's in our parking lot. There's other pieces on here such as mental health that could, you can tie into that, the social experiences as well as culture and climate in certain aspects. I think the next 2 would talk about mental
Well,
health, I think it's mental.
Yeah, but just to be clear, I don't think there's anything that says, it says special ed, I don't think it says mental health. So I just want to make sure that when we're talking
Wasn't
about.
talking that piece.
That one, the next
Oh, all right.
two, the next 2 are mental health.
Oh, all right.
So I think what we're saying is that one, even though it has like multiple
It's being
factors,
addressed
it's
in
gonna
other
be
levels. All
addressed
right, I just wanted to make
All
sure.
other topics
in
that
all
we
of
have
the
planned.
topics, yeah. More bullying awareness.
I know you're gonna hate it, but it's kind of culture inclusion.
I'm not gonna read the whole thing. Yeah, culture and climate.
Yeah, well, it builds a culture in which we do not tolerate it, how do you educate kids to knock it off? Unfortunately, this has been going around since the day they started school many centuries ago. It just got worse as technology evolves.
And then more resources for kids and parents if they are needed to help them succeed in their education.
Is there anything on any of the other ones about parent involvement?
Outreach or something?
Are you talking about other committees or are you talking about this one, Karen?
Other committees, because there's not one on here.
Yeah, I wouldn't,
Parent
there has been comments already, family engagement opportunities, that is stated already on here,
So we should do new parent engagement? A new category? That would fall under parent engagement?
More resources for parents and kids if they need help them succeed.
Yeah.
So, what is the objective of this? Because I sometimes
Or would
struggle.
that be school-based? Is this a
Well,
district level
I don't think it's
versus
a
school
district
board
level, but I don't know, sometimes what I've talked to people about, what they're looking for, though it's opportunities where you can have parents and kids interact in the same environment in the building. So like an after-school, like dance or something. Sometimes what they're looking for is not something that, we're here to educate your kids, give them the tools to succeed in life, but that's more of a medical expertise, is what I'm getting at.
Oh, I didn't read it
Or
that way.
I'm
I think
reading
we
it
just
as
put it under
tutoring.
parent engagement and then decide if we want to put it in the parking
That's
lot
fair.
afterwards.
I'm reading it as like resources for them to help their kids access the education.
Yeah.
Oh,
they're at
perfect,
home.
I like that.
That's kind of
a
how
better
I took it.
interpretation.
How does a parent, like,
Help assist their kids in their education while they're at home, after school, homework, like,
Yeah, I just sometimes feel like we're being asked of the district to do more than what we should be doing, but I see what you guys are saying now.
I don't disagree with you, I just think it kind of, for me,
On
it
that
just
point,
looked like it falls under parent engagement,
With you
because
on
they, I mean, we want parents to be engaged.
more support for the mental health of students. So it's
Gotta go with mental health now.
Mental health. And then my biggest concern is staff retention, losing good teachers, other districts that are paying more support for students with behavioral needs that may not qualify for special ed, but still need support in class, child's classroom, yeah. That's
So
an
where we
example.
come into play was the coaching pay, which was also already one of our topics, and money, time into middle school athletics, which is part of the athletic needs study. So it's already covered for special services part of this. The other part is personnel.
Yeah, the paying coaches too was also addressed too with
Yeah.
athletic stipends, yeah.
So those are already in the parking lot items.
Oh, the next one I think is parent
Oh,
engagement.
parent engagement.
I actually don't,
Ah, come on, Karen. I
but
can
we'll,
read.
you know what, we'll put it down under parent engagement to make it happen.
Parents should be notified when a classroom becomes unsafe due to student behavior causing the class to leave the room.
We can't, so that is not,
That's not a school board thing, that would be
That's
a
not
Yeah,
even a
it's nothing we
district
can
thing.
address.
building level thing.
what they can and cannot say is
And
already in place.
safety, so there wasn't an elaboration on safety, so it really could fall under building safety or
I'm looking at building and I don't see one under
the
building.
building will do that. when
That's
they-
in the community survey comments, so they can add that to it.
Okay,
So this would be more of our special services safety, which I think is covered in other discussions above. So
yeah.
Yeah,
redundancy.
special education. There's not much information provided in that as far as,
Yeah, we maintain state standards in
Yeah.
special education.
We maintain higher than state standard in special education.
Pardon me, I've been corrected.
Thank you.
student mental health. How about mental health?
Do you really want to put other mental health?
I would agree with Karen on this one.
Teacher retention, student behavior, class sizes, mental health resources for students,
So we go mental health for our part.
and.
Staffing retention is part of personnel.
Yeah, personnel and
There's 3 committees on
instruction.
this one.
Yeah, so when it shows up like this, Karen, it'll show up on theirs as well. It's like, they'll see the same comment on their documents too.
Okay.
So we could all just be shuffling it around.
Yeah.
Student behavior.
Class,
Figured it out.
class sizes, that's a policy, so that's a district, that's a policy, school board policy. So everything else, student behavior, mental health, so mental health. That's how it relates to us. There are many concerns at the moment.
Retention
Staff
salary, that's
retention
same.
salary.
Monkeypox and COVID
Pandemic
is
related
our area.
issues.
No.
Yeah, that's why I ended up here. Monkeypox, COVID, that falls in
Student
special
health.
services. So new student health. And then winter sports and their needs are not being addressed.
That's under our
Athletics.
athletic needs study.
Um,
Yeah.
parking lot.
It's too cold anyways.
Too cold.
All right, so thank you. That was less painful than I thought it would be.
So with that, the items we have new are mental health,
Culture and
culture,
climate,
climate, parent engagement,
engagement, and staffing, well, that staffing needs goes to personnel, not us.
and student health.
Can you say
So-
that again? I'm sorry.
Mental health, culture and climate, parent engagement,
And student health.
wouldn't that fall under, can we just put student/mental health?
It could also
No,
be
health too.
culture.
It was like COVID and
It's the
monkeypox
COVID.
health.
Yeah,
It was the pandemic thing.
like really health. Physical health, disease, family. I recommend
So
to,
there's only 4.
there's only 4 new categories, which we can always refer to this community comments to help gauge discussion. But I'd recommend the committee to now add these 4 to the parking lot and ask the district to provide from department heads in the subject field their topics for the next meeting.
So, Ms. Hebert, can you reach out to Kevin Hebert and Sarah Reinhardt to see what recommendations they have that they would like to see
Should
under
also
special
add,
services 5-year?
The
Yep.
drama band as well.
Oh, yeah, and the director of music and,
Or any department in which you know also should be included.
Okay.
I mean, culture and climate, would that fall
Guidance.
under
Guidance
guidance or
counselors.
building principles?
I wouldn't give her a list, I'd say bring forward what districts under these topics, she sees what we have, she knows all the pieces. There could be crossover from other departments.
I would suggest a little change because it bothers me. What's that? We don't have a mascot.
We have a logo.
We have a
We have a logo,
logo.
true.
I
You're right, thank
agree
you, Ms.
with you.
Grassi.
So I think staying away from the word mascot
yes.
True.
might help.
We just wrote the comments as they were. in
Right,
the
I get
survey.
that, but I think we should avoid mascot at all
I
costs.
agree.
That's a good
I also think we need to, and I know the 2 people that came and presented at Special Services, I think we need to reach out and just say, it's a discussion again. You came and spoke, and we haven't heard from you.
Regarding what?
I just think it's gonna come up again. It seems to come up every
I'd let that
4
group
years.
I
come
would
forward
let them
and
bring
let
it,
them
I
do
would
it, yeah.
reach out.
Huh?
I wouldn't.
I wouldn't
solicit.
encourage it.
I would just, if they're ready to come forward, let them come forward. I think what you already said tonight is what we already committed we wanted to do. We just need
As
to
a
now
district.
follow up to say, what are we doing to educate people on our logo, on,
And you know, it's changing. If you look at the uniforms, newer uniforms,
yeah, so
they're not putting that logo on it anymore.
it's an awareness.
No, but it's a
program.
lot of it is the name as well. Do you know what I mean? It's,
Well, I think this is a great debate. I don't want to have to.
I don't want to either, I'm just saying, you know
I
what
think it's
mean?
more of a building level thing, like what the, you know, what our staff want to do to educate the kids.
I would say we're also talking about culture and climate. I'd like to get some students involved in that as well. I know that, I mean, we were even talking about the lady with mental health, like, we, you know, a lot of these discussions when we're running for election where the students wanted the athletic concerns, being a D1 school. So if there's a way that we can incorporate some students into some of these, if you could, in your infinite wisdom, figure out where they would go.
Well, I think we would wait, Karen, until we have our top 3 established, once we get input from department heads, and we look at our parking lot again, and we reprioritize as needed. Once we have our top 3, that is when we as a committee have to work toward those 3 things each month.
See, my view is, if we're incorporating other people other than the school board, when you look at personnel, I think the students should be equally added input than the building. I mean, I don't care which way we go, but I just think if you're gonna incorporate to the building level, I think that building level should also include students at some level. What do you say?
For 5-year perspective, we've gone to the community We're asking for district input now. We've gone to the school board that represents the entire community. We always are open to students bringing forward things. That's something that the committees can discuss, but perspective of 5-year, to get a 5-year plan together, we've had a lot of input. And
So
students,
you're saying just
no,
the
students
staff?
were already involved in community.
But weren't the staff as well?
Yeah, this is district department heads from a district business running perspective. What they're already working on, what they know are in the trends of the state level, what are the trends they're seeing in education in general. That's what this focus is on now. We have done the community aspect, we've done the board aspect, we brought in students with our community survey.
So who do you consider, can you define district
Kevin
heads?
Huber,
Admins.
athletic director,
Administrators,
Administration.
All right.
department heads.
They
department
may
heads of
engage
music.
their
I
students.
thought when you were talking about district heads, I thought you were talking about more than just administrators. So that's, thank you for that.
Thing is, there's no restriction. Some department heads may engage with their staff more. We're not gonna micromanage who they talk to. They might already have this plan, like Mr. Toddy has his plan together. So
I just thought
he's just gonna come in with his plan.
nurse department head would be good to reach
Yeah,
out
she's
to.
got that already. Leave that to them. You don't need to tell them every department. She knows the aspects that are coming here.
All right,
We'll get it.
so we have those 4
Some of
added.
the things may be already in the works. It's up to us to winnow this down, to look, to see what we're gonna really look at in the next 5 years. See what it is. We're deciding what we're gonna look at in the next 5 years. When we get to that point, we can start including kids, parents and kids.
I completely
We
understand.
gotta have a plan.
Right, I completely understand. I just want to make sure when we're making, and again, number 1, under special services athletic field, so I don't think we're not listening to what was said. I just want to make sure that we are a school board that provides the services and staff for our students to get a better education, and I just want to make sure their voices are heard. I feel we have, now that I've gotten clarity on what a district head is, but I think I just want to make sure we're involving other people, that we just keep that in mind, which I feel like we have.
All right, so next month we'll review the department head for November, third list. All right,
Means you
so,
probably won't get to 5-year till December, correct?
yeah,
Earliest.
yep, our next meeting is in November. And then we'll have to prioritize our top 3 again, once we see the full list in November. As a committee, we'll have to take that input and then decide whether we need to change our top 3 or leave them where they are and have our parking lot. All right, thank you. So the next thing is public comment. Is there anyone from
There
the
is no
public?
public.
There is no public, so
Motion
I'll
to
close
adjourn.
public comment.
I had one
Yeah.
other.
Sorry.
Yeah.
They had asked about the wrestling mats last month. And so, they looked at them, they're safe to use, but they are old, they've been around a long time. So if they're not replaced in this current year, they'll be replaced and budgeted for next year. So it is on the list of something that does need to be replaced,
And they'll be budgeted this cycle for next year.
more likely, yeah.
Do you know how much the cost of those are?
It can be anywhere from 10 to 20,000. They're all gonna have to go out and do research and go out to bid.
So if it's something, as the school year progresses, maybe it's something we can do. If not, that's great.
Well, it's good to know if there's extra money at the end of the
That's
year,
what
that would be
yeah.
something we could buy.
Yeah,
All right,
it's on the list.
anything else under other?
Just one follow-up question on that. When you are getting that bid, is there possibilities of lead time? Because that's right now a sensitive topic is it 6 months before it shows up, that might help our decision process,
Okay.
when they're gathering that intel.
Anything else under other? Is there a motion to adjourn?
So moved.
Second. All those in favor, signify by saying aye.
Aye.
Opposed? Motion carries.